Welcome back. I'm so excited today. And I say that a lot, don't I? For those regular listeners, I want you to tell me how often I say that I'm excited for a guest, but this time I'm totally serious. And let me tell you why. So, medical billing and dental is such a hot topic right now, and there's so many different opinions on it, right? So, as many human beings there's that. I'm not going to say that. That would definitely take this into the rated R category, and I try to keep it PG for all the listening audience out there. But my friend Leslie is on the show today, and she's going to tell me how to pronounce her last name because I didn't ask. I'm going to say it's Icenogle. What is it, Leslie?
Icenogle. Icenogle.
Oh, Icenogle. I was so close.
If
But
I know
anyway,
your name
so
right, yeah.
Leslie, Leslie's on the show today, and Leslie brings over 40 years of dental industry experience, specializing in oral and maxillofacial surgery and medical billing for dental practices. As the founder of Dental Classroom LLC, she offers recorded courses and live coaching to help dental teams optimize cash flow, leverage medical benefits, and improve case acceptance. So, welcome to the program, Leslie. I'm so excited to have you on today. We're going to get
Thank
into it.
you.
Yeah, gloves are going to get off. I mean, I think you know me well enough to know that this isn't going to be no softball, easy questions, sales pitch kind of podcast episode today, right? You know that. Good stuff. Well, I want to start out right because you know that my clients were in the full arch lane, but our listening audience, because it's all about the business of dentistry. I mean, we have a wide range from clinicians and office staff, and those in the manufacturing space, and those that are entrepreneurs. I mean, all across the board. So when you talk about medical billing in dental, right away, people have opinions on it, right? They either say, oh, it's a great opportunity, absolutely. And others, and I'm thinking most, are thinking what I think initially when I think of is, oh, I'd rather go and have, a hot poker stuck in my eye. So tell me, this topic, you, how did you get started in this topic of all things? Go back to your origin story. Tell me a little bit about that, my listening audience.
Absolutely. Well, I started out in dentistry for a co-op through high school, and I did pediatrics for a couple of years. Then I was in oral surgery for 32 years. And with oral surgery, you've got trauma. So I started my medical billing career very early when, I used to actually transcribe for the operative notes and things and code it from that actual operative note. So medical billing is something that I've been used to for years. It's in our industry, whether we like it or not. I mean, I love your beautiful grunt over that because that is true. But when practices bring in like ancillary procedures, like they start doing implants or impacted teeth removal, that puts them in the medical insurance world, whether they want it or not. So I always say if you have clinical training for those procedures, you also need administrative training in order to get patients the benefits they're entitled to or give them another financial resource. You're all on X's. We see a lot of coverage, especially if the patient is really having a hard time masticating their food, they're having digestive issues, or maybe they have Parkinson's disease and they're choking on their food. These are things that medical insurance there's benefits for. And Greg, whether we like it or not, which I believe, it's a little scary, with Medicare, July 1st of 2024, they started accepting electronic dental claim forms because there are more procedures that they're covering. And it really reminds me of a scenario back many years ago, late 80s, of a lady that had several digestive surgeries, not successful. Her doctor, her physician said, why don't you go see your dentist? Because he knew she was a denture wearer, very little mandible. So we reconstructed her mouth, literally took care of her digestive issues. And it would have really saved that medical insurance carrier a lot of money if they would have taken care of the digestive system here in the oral cavity versus before it manifests down to other, issues. So I think they're realizing that it is a money saver if they take care of the problem in the oral cavity first. So, whether we like it or not, it is in our field, and it can be not only very lucrative, but it's a very simple process, just like dental insurance. Although simple and insurance doesn't usually go hand in hand. But I always say, if I can do it, you can do it, right? It's a very easy thing.
Yeah, two words not usually used together, right? Insurance and simple are not not typically used together. But I think, the story that you tell about the gal that was having the digestive issues, it sounds like it was an early on mouth body connection, right? Save yourself further down the line, and we could go down the path of how many people have dealt with medical concerns and billing concerns on the medical side in general, just outside of dental, where it's save yourself the challenge, right? I was dealing with some rescue medication that they said, oh, now it's not medically necessary. You've been approving it the last 3.5 years. Now suddenly it's not. Would you rather have I run out and end up in the emergency room and then get an IV for this same medication? And how much more is that going to cost? But I digress, because what you're talking about as well is, and I love that you use the term, adding ancillary procedures, because medical billing in dental isn't new, but typically it's been in the OMS space. And so for now that there's expanded services in so many of the GP practices, and they have the clinical training in so many aspects for these ancillary services that are being added in my lane, the all on X, but in many others, right? And in air pathways. And we could go on and on about the other different services, but having the administrative, right, or having the skill set for the rest of the team. And it reminds me of like Laura Nelson and Front Office Rocks and the work that she does with her teams, that they're almost like an afterthought or a not even thought of, um, aside from the financial impact. And so what have you been able to do, or what are you doing to change that mindset for practices, right? Other than building a business out of this, right? So what have you been doing to kind of change that tone and tenor and how it's being presented into the marketplace, into this industry of dental that we know and love?
It's basically in our field, whether we like it or not, Greg. And the thing about it is, patients have benefits they're entitled to. And you'll see your medical insurance companies. I'm in Indiana, Blue Cross Blue Shield, the largest employer, high rises everywhere because, of the fact that, we want to get patients the benefits they're entitled to. And there are some auxiliary, admin teams that are just really excited to help patients get those benefits. And then there's others that are just, like you were saying, just stay far away. I don't want anything to do with it. But how long can we say that? Because with the oral systemic link and all the inflammatory procedures and things that, cardiovascular disease and strokes and different things, I mean, it's in our field, and you might as well, really just adapt to it. It's something that can be very lucrative. And like I said, it's not that hard to implement. So like a GNA consult, you have systems and procedures you put in fact, and then it just all smoothly runs. And it's the same way with medical billing. So
Well, and you bring it up. And so, at GNA Consult, we have two sides to our business, right? So it's the teach, coach, and train every touch point of the patient journey, right? For the leads that come in, to be able to convert those leads into consultations, reducing the no-show rate, right? To get them to show up and actually come in for the consultations. And then on the consultation side, to be able to train that aspect, to be able to use the verbiage and walk with the patients to convert those 20, 30, $60,000 cases into starts, so they actually do the procedures, right, to get the ROI on the marketing dollars, and also the workflows and the processes. And then the other side of the business is the ops side, right? Because operations are such an important aspect to the business in order to support the sales side, just to call it in a very generic term, as we like to simplify things and create more efficiencies. And when it comes to that sales side and the lead generation side and being able to convert, there's really two options, right? It's really investing in the teaching and coaching of internal teams to level up their skills. So and that's the most optimal way, because then that is evergreen. They can, continue to do that and get better at it with their teams forever and ever, right? The other is outsourcing that, right? And let somebody else take their phone calls to book the consultations. It's not as ideal because, again, you don't have the personal touch and the personal branding, and we could go on for days on that. So those are generically the couple of the options that are available, but there's advantages and disadvantages to each. So how about with medical billing? So talk to me a little bit about, for patients, or sorry, for clients and options and practices, Because I would have to imagine that the learning has to be, I mean, it's a lot. I hear it from others, right? But also the outsourcing of, oh, a trusted source of, because I hear from so many, well, we used X, Y, and Z, and this was the result. And most of the time, we don't hear about the good results. So tell me a little bit about that landscape from your perspective of what you know, so my listening audience can have an idea of what that looks like.
Well, I do believe you hit the nail on the head when you said, you have this learning, right? And then a lot of the programs you go to, maybe it's a day and a half, whatever, then you're on your own. And that's why I did, get the insurance, as far as the dental classroom online, is so that I can hold their hand. So it comes with a year of coaching. And I think that that's the important thing, is that when I do a day and a half course, the questions really don't come until 45 days later, when they get a request for information, or maybe the first denial, or their doctor's not, credentialed properly. That's when the questions start. So I feel like the reason that a medical billing class can not feel so successful is the support afterwards is not there. So I have mine set up for group virtual consulting. Everybody can, bring their issues and their questions. Everybody can learn from each other. And then I have videos. It's set out into 12 different modules. So, for instance, the documentation, if I have a sleep practice, maybe that practitioner wants to listen to just the documentation or just the sleep apnea module. So it's broken out. Not only does it get CEs, but it's broken out to where it's a long term success, so that you can have your hand held for an entire year. You could rejoin with more coaching if you want, but it's just like having a learning platform there in your office, that really your auxiliary can take advantage of, and maybe point out, hey, I think this is a good one for the doctors to listen to as well. So that's why I feel like some people feel like, okay, I went to a day and a half course, but it just wasn't successful. First of all, is the doctor in CAQH to where these medical payers even know who they are? Are they legit? They're going to be checked out by these medical insurance companies. Do they have the proper paperwork? So they don't have to be contracted, but credentialed. So in my classes, I teach, take 5 past cases that you've done that you really feel should be covered. So the last doctor I talked to this week, he said, he had a police officer that had history of drug abuse and had lost all of his teeth. Let's take that. Let's run that through the medical payers. And first of all, we're going to get credentialed and hopefully get him reimbursed. So at first, not to get frustrated, I would say let's take some past ones, but let's look at the patient and say, hey, think of this as a gift if your medical insurance pays. I don't want them to go in thinking, oh, yeah, I only have to pay 20%, and then not get that coverage, right? So we want to make sure that they have some financial option, an outside lending agency or what have you, and then say, hey, we're going to go the extra mile to get you the benefits you're entitled to. And bam, that's how I would address it at first. Until unless you're doing like TMJ or, sleep service, where we know it's covered, but especially with the all on X's, this is where I'm thinking of here. It's not what you do, it's why you did it and how we communicate that to the payer. So, what we seek coverage for, is your trauma injury, whether it be a fractured tooth or a broken off tooth or a jaw fracture. And then the replacement, the sequela, the late effect. They're going to pay for an implant, abutment crown, they're not just going to replace the root of the tooth, they're going to do it all. And to my oral surgery listeners, I always like to remind them, if you do get this covered under the medical, remember to help your referring dentist who is restoring that case get their benefits too. Another quick story, Greg. Post office, I went in and I had an implant logo on my shirt, and the lady at the counter said, hey, I know what those are. My daughter had 4. So I automatically think of congenitally missing canines, right? So I said, oh, did your medical insurance pay for that? I know where she works. And she said, well, I asked the dentist about that, and they said, no, that's not covered. I said, did they actually call your medical? No. I said, come over on your lunch break. We'll just give them a call. 75% coverage for the implants, bone grafts, abutments, and crowns. I knew where she worked. I knew she had a good plan. So, you just have to really think outside of the box and try to get that patient the benefits that they deserve and are entitled to, they're paying for. Just like with you and your consults, it's like, I'm really ensuring this patient, I want to help them make the right decision about their oral health. And that's really what I'm here to do. And that may be an all on X case. Same thing with insurance. It's just like, helping the patients. They don't know. And they often expect us to be the experts of whether it's covered. But it really irritates me when someone says, oh, no, it's not covered without calling their benefits. They don't know. Say, oh, it's an interesting question. You might want to look into that if they don't want to go there. But you can't say that it's not covered unless you've actually contacted. Congenital defects are covered. So that's, the short answer to that or the long answer.
Well, no, and what you're describing really, it's an education process not only for the patients but for the clinicians as well. Rather than taking the shortcut, is really finding for the benefit of the patient. And then I love how you talked about it's that questions come up 45 days after, typically after, doing the weekend seminar, because it's true with what we do at GNA Consult is the weekly online training sessions and then the monthly in office follow up that we do in order to reinforce the concepts. If it's not if it's a new habit you're trying to create, if it's a new concept, a new habit, a new tool, a new learning, it's commonly known, not just in dental, but just in general, any habit, right? For those of you that are listening now that, are a month in or 6 weeks into your new gym routine, and bought a gym membership January 1, how's that going? For those of you who have been doing it year round, and you got like crunched out of your gym and you couldn't get onto the machines because all the people like flooded in, right? And it's what is it? It's the new resolution quit Friday is the second Friday of January, and they're like, look it up. There was a huge commercial this year. We were talking about it. I was with a coaching friend of mine, Heather McGuire, who's in Michigan as well. Go blue. And she was talking about like she's putting together a program for those that want to restart after the New Year's resolution had faded, right? And they feel like they failed, right? Words that we have to be mindful of, not to be using and beating ourselves up with. And it's because the new habits, right, to make it incorporate into a part of who you are. Same with this of what I'm hearing from you, and that's the year of coaching to follow up with in order to support, because once they start like trying to flex that muscle, that's where the support comes in. And I love to hear that you talk about that. The other thing that you mentioned was the expectations piece, right? Is having an expectation of realistic results, right? Not saying, like from some of the marketing companies and all on X, right? Oh, we'll get you 10 cases guaranteed. Like, no. Like, let's be realistic about we're going to get you everything you're entitled to. What we've seen with others typically is, right, that the words matter. And then lastly, I love that you said it's not the what, it's the why, right? We at GNA Consult talk about the why behind the what, the motivation that patients have, right? Not the teeth you get in the mouth, right? That's so critically important, and I love that. So with what you're doing and teaching and coaching, uh, tell me what you're finding with clients that you're working with that maybe have had experiences elsewhere. What is that tipping point where you're finding, like, when you have somebody dedicated, committed, learning for the filing and billing, like, what's one of the pieces that they're finding that they can have success with, where maybe in the past that they've tried doing medical billing that was a challenge for them? I know you said credentialing was, it sounded like that was one of like the missing links, that was one of the pieces, if you will. But what's another that just seems to be one of the bugaboos that holds them up from making the progress, like taking that giant leap? We know for us what it is. It's actually listening to the recorded calls. For those that are taking phone calls, right? God bless all the people that are taking the lead calls from inbound, like the outbound marketing, like and the incoming calls. God bless you, because you can do it. No, thank you. Like over and over and over, or like, surveys come in and they're making 20, 30 calls outbound and getting voicemail or hung up on, or who's this? What? Now? I mean, oh, like day in, day out, like you are the gods of the world, if you ask me. So how about for yourself? Like, what are you finding besides the credentialing that tends to
Mhm.
be like that bugaboo? Like it clicks,
Right.
they get it, and they're like, wow, it's amazing.
It's 100% payer specific. Okay, that's not an easy word. Payer specificity. The specific
Specificity.
for
I think that's
me,
that's like your last name. We both got the word. We both got a word. See, now we're 1-1. Let's keep track. 1-1. One for Leslie, one for Greg. And what is payer specificity for those of us who don't know insurance language, or somebody as smart as you?
they basically have different requirements as far as how you will report, say, anesthesia time on a claim or units. So, for instance, let's take 4 impacted wisdom teeth. Some of them want it on one line with 4 units, and they pay better that way. Where if you will itemize it, they'll pay 80% on the first procedure, 60% on the second. So you can get the patient better benefits by putting in one line. So I have it in my classes, a payer preference sheet. And once you fill that out, because a lot of people aren't aware that there is what they used to call an oral surgery department in the medical insurance, but now they call it dental department inside the medical insurance. So you need to get to the right department first. Then you need to have these questions answered. Okay, how do do you accept a mixture of CPT and HCPCS codes, or do I have to do just one? And if so, which one is that? So once you find out if they do accept these, so for instance, your Blue Cross Blue Shields, your Anthems love HCPCS, where some of the other payers just want CPT. So once you learn, and I've also found, Greg, that there's usually 5 big payers in your area that you really have to get to know very well. Usually the top 2 are who you file with the most. So when you figure out, how this thing works, because I'm a big believer, and they'll hear this several times, do it right the first time. Just like in dental insurance, you want to put the proper attachments and things with it. You have to have proper documentation so that you can select the proper codes. Then there's also some little tricks of the trade to know, which one has the hardest RVU, to make sure you put that on top if they do. Let's say you're doing a bilateral chondral fracture and then maybe a laceration. Which one do you put on top to optimize your reimbursement? But for, the like TMJ and different things like that, it's really very easy because there's not a lot of codes that you need to know. It's just a matter of getting your feet wet, getting in there and doing it, and realizing, oh yeah, this, if Leslie can do it, anybody can do it.
Well, you were saying easy, but you lost me at CPT and CVU and EIEIO. I don't even know what you were saying there,
Yeah.
and I'm just thinking like old MacDonald had a farm. So you were losing me, Leslie. So people got to reach out to you because that was great. Well, Leslie, this is the part of the program. Every one of my guests play a little something called "What the Sleuth is Going On." It's 3 rapid fire questions. First thing that comes to mind. Are you ready to play?
Get ready.
Excellent. Question number 1. What's the worst bad breath you've ever encountered?
Well, first of all, periodontal disease, I am like a canine. My nose can smell that out a mile away. And I had a plumber one time that came, and I literally had to go halfway up the stairs. I could not stay in the same room with him. Thankfully, I had an infant at the time, so I acted like I was going up there with the infant, but I was screaming across. So that plumber, I could diagnose periodontal disease, and hopefully he's gotten that under control.
Perio disease, I'm telling you, with as much as I traveled last year, I can smell somebody coming onto a plane from 10 rows away that has perio disease now. I want to thank the dental industry for the 18 years that they've given me, because now I can't not smell it. I didn't know what it was before, but now that I have full awareness, thank you. Thank you to the dental industry.
And thank you for masks.
Unbelievable.
And when I first started in dentistry, we didn't wear masks. So,
Oh, that's just terrible. I wouldn't have survived the first month because my first, week 3, I was asked, because I worked for a company that had bone grafting material. And so they sent me to a cadaver lab at a location with cadavers, mask. And I didn't know the tricks. And somebody was very kind from another company and had a little bottle of Vicks and said, here, just stick this in your nose and on the inside of your mouth. And I still was like, the whole time. And then I didn't even realize, I came home, your clothes smell like the formaldehyde.
Well, thankfully I have not done that. But yes, I knew the Vicks trick because they're
week 3. That was week 3, Leslie, in dental. That's cruel and unusual punishment, but I digress. Okay, question number 2. If you could change one thing about your smile, what would it be?
I would definitely get my enamel back again. I used to have beautiful white teeth and I strongly brushed with hard toothbrushes there again. Back in the day, that's kind of what they were saying to do. And I would get my enamel back so I could have that world. I'm not even a candidate for
How
white.
has nobody invented like enamel repair something? Come on, people. Come on.
Exactly.
It's terrible. Terrible. I'm calling out every single inventor that knows anything about dental. Come on. Make it happen. Okay, question number 3. If you could go back and be the inventor of any dental product and no, you can't use your own, which one would you choose and why?
Now that is an easy one, and it would be the endosteal implant. And the reason is because for years, dentists would replace the crown of a tooth. Denture, partials, even a bridge for that matter, was replacing the crown. We need to replace the root so we can maintain that bone structure and, not have bite collapse. And
are you just playing to the host? Is that what you're doing? So that we'll promote you even more of this on this episode. Is that what's going on, Leslie?
I'll tell you what, Greg, I started out speaking on implants and consulting and consults and things like that. My niche for medical billing found me. That's not what I originally started speaking about.
Find your passion. Let it find you. I love it. Love it. Love it. Yeah. Oh, that's amazing. Well, I want to respect your time, Leslie, and all of my listening audience. So is there anything I haven't asked you or you want to share on the episode today before we close out the show?
I think you've covered it all. Just remember that, patients have benefits they're entitled to, whether it's surgical procedures or pathology or, sleep apnea. And I better point out too, the Mandatory Filing Act by Medicare. So we don't want violations or, civil penalties, et cetera. So if you have crossed into, the all on X's or the sleep or whatever, you've got to be aware of what needs to be filed with Medicare. And that's it.
Oh, thank you so much. And Leslie, the founder of the Dental Classroom LLC, how do people find you?
They can reach me at Leslie at dentalclassroomonline.com. And I would love to hear from everybody. It's really fun helping people succeed in medical billing.
Perfect. We'll make sure that gets in the show notes as well. Thank you so much for being a guest on the Two Sleuth podcast. And see, it wasn't that painful to hear about medical billing and dental. It's already a part of what you're doing. It's already a part of our industry. Thanks so much, Leslie. It was great talking to you today.